You know, the 2020 Transplant Games, the reimagined Transplant Games, so many people there. Well, one person we didn't get a chance to speak to on location, but we definitely caught up with because he's doing such important work is Dr. Michael Goldstein, who is director of the Division of Organ Transplantation, director of the Kidney and Pancreas Transplantation at Hackensack University Medical Center. Here's that conversation. Dr. Goldstein, let me ask you, the 2020 Transplant Games at American Dream, why does it matter so much, particularly to the transplant community?
The Transplant Games are a celebration of the opportunity for patients with end organ disease to celebrate a rebirth of their new function and a new life with their new organ. And at the same time, it celebrates the donors and the donor families that have been so gracious to donate these life-saving gifts to these individuals.
Describe the work at Hackensack University Medical Center, particularly as it relates to organ preservation and organ transplantation.
At Hackensack University Medical Center, we perform kidney and pancreas transplantation for adults and children. We are one of the few certified centers in the state of New Jersey to perform transplantation. And at our center, our goals are to improve the quality and the length of life for patients who are suffering from end-stage kidney disease through the opportunity of kidney transplantation. And we have brought a world-class team of transplant experts together to provide really clinical excellence in transplantation, to shorten the waiting times for people in need of kidney transplants, and to provide the best clinical outcomes that we are able to provide.
Doctor, what has been the impact of COVID-19 on the transplant community, particularly given the work that you and your colleagues are doing?
COVID-19 has been somewhat devastating, I think, not only for the entire world, but transplant patients uniquely are more predisposed to this type of viral disease, and because of their immune compromised systems and their end organ, medical health. When the pandemic hit back in March of 2020, it was very unclear how we were going to provide a safe environment for patients with such complicated medical diseases and that were going to need to be immunosuppressed. The pandemic was so critical at that time that we actually had to inactivate our waiting list for a short period of time so we could establish safe processes to make sure we can provide an environment that was safe to do organ transplantation. So for about 10 weeks, patients did not have opportunities to receive transplants because we felt that it was too dangerous in the setting of COVID-19. After putting a number of safety measures in place at Hackensack University Medical Center, by doing infrared testing for detecting fever, by creating a specialized transplant unit that was COVID-free, to providing screening for all visitation, limiting visitation as well, and masking policies. We felt that we were able to provide a safe environment so patients would once again have that opportunity for life-saving organ transplantation.
Final question, Doctor. For you, the greatest personal satisfaction and gratification you get out of your work is?
Saving lives. The most important thing that I do and the thing that I enjoy the most is to be able to come out into the recovery room to tell the family members that everything went well, the transplant was successful, and their loved one was going to have an opportunity to live a normal, healthy life. This is incredibly rewarding, and I get to know my patients and their families year and year after year and for their entire life, and get to meet, and celebrate their life and their stories, year after year. And that's really special for me.
Thank you, Doctor.
Okay, thank you very much.
We are the Community Food Bank of New Jersey, and we are there. We are there for more than 1,000 food pantry and feeding program partners. We are there for our neighbors in need, nearly 1 million of them who struggle with hunger. Working together with volunteers, partners, and donors like you, We fill the emptiness caused by hunger with food, help, and hope. We are CFBNJ, and we are there. Join us. Go to cfbnj.org now.